Once the site is healed, you want to evaluate with a three-dimensional scan. So in 2D, it looks quite good, but remember, we'll have a natural resorption process. And in spite of my effort, and I want to make a very important point here, you can graft all you want, and you can put anything you want in there. Your ridges are in the process of resorption. That's why we are now thinking about dentin grafting and socket shield techniques, and we're trying to improve that. But we need to stage our treatments in the aesthetic zone to give us some opportunities to graft more bone and tissue to give us better results. And what happens after the implant has been restored? Does the tissue and bone loss continue? Actually, it does. It does continue. And that's very challenging over the years. So this is not a perfect treatment, and we're trying to come up with some other techniques that are a little bit more stable. So I naturally scanned this patient and had a three-dimensional view, and we have some collapse of the ridge. You can tell that. Now take advantage, and it doesn't matter what type of guidance you use. You want to place your implant in the proper restorative position, but we still need to address the existing deficiency. So although my implant is placed, and I'm going to place my implant in the ideal restorative position, as long as the bone allows me to do that. This is not a huge defect. This is a moderate defect, slight to moderate. I can still place my implant in good bone and get good initial stability, but I obviously need to augment the buccal plate. So I'm going to use the compartment technique, and of course, I'll have to make sure that I place my implant in the right restorative position, and also from an apical coronal position, I need to make sure that I've submerged it enough to make sure I have enough room for an emergence profile. But the compartment technique is going to become useful also around implants. So if your ridges are deficient, use some sort of slowly resorbing graft on the buccal, and use your collagen membrane and close the tissue. And of course, this is the staged approach, because this patient has a provisional, and I was able to create primary closure because it was closed primarily. But don't forget, I augmented the ridge. I augmented the ridge at the time of placement. I need to gain back more tissue to cover, and that's by releasing more apically. And sometimes you can be a little bit too overzealous to close up a flap, and it's closed primarily. Look at the right picture. I was pretty proud of myself. But if you look at the right picture, I'm getting a collapse of the papilla, and that can be very, very concerning. Now, the only way this is going to recover is if the soft tissue, if the interproximal tissue and bone, the bone, is going to stay where it's at. So really, the best predictor for your implant aesthetics is not the implant. It's not what you did in terms of horizontal augmentation. It's the attachment on the adjacent teeth, like what we see here. Okay, so I was able to get quite a acceptable, nice result with interproximal tissue. Very similar to what the patient started with. I was almost tempted to do a little bit of crown lengthening on the number 9 on the right central incisor to make sure that these match, but this patient was very, very happy. Extractions are very challenging. Extractions can be daunting and laborious, and many times you need to stage your treatment, and you need to make sure that you have opportunities to graft more bone and tissue. And I personally find that the compartment technique is very helpful.